Welcome, everyone. This is Lynn Kintz with the Hemophilia Council of California. The Hemophilia Council of California's mission is to improve access to care and treatment options in order to advance the quality of life for people with bleeding disorders through advocacy, education, and outreach in collaboration with our founding member organizations, which are the other patient groups here in California. And we are happy to welcome you to the presentation today. I would like to introduce Amber. She is with the Treatment Center in Nevada. Looking forward to hearing her presentation today about women and bleeding disorders.
It's important to tell your story and to tell your story to someone who is outside of the hemophilia community. If you tell your story to someone who is inside of it, they will completely understand your terminology. They'll understand your history. So it's important that you can tell this story to someone else. What we have done in Nevada is had our patients get together with our Diabetes Foundation and tell their stories between each other so that they can better understand how that they can tell each other their story so that they understand it. It's also impacted by how often you have told it. So sometimes you get stuck in that rut of, I've said this 1,000 times and I don't think it's getting through. That's a sign that we need to start telling it in a new way. It is impacted by who you tell it to, and I will always be honest with everybody that under the best of circumstances, under the best of advocacy, you're still going to encounter people who will not listen. But it doesn't mean you don't try again, and it doesn't mean you get angry with that person. It just means that you know that you have tried to do your best, and then you move on. Don't perseverate in it. Don't think about it. Don't let the negative stories become the only story that you have. Share the positive ones where you've educated providers, clinicians, other patients with other disorders, and celebrate those because we have too many negative stories that are pervasive in our community. So how to effectively tell your story? Like I said, be objective and try to be short. The shorter it is, the better the chances that they'll have to integrate the information that they have been given. Try to be consistent from the time you tell it before to the next time, and be as accurate as you can in small pieces. So try to shorten it if you can. Like I said, people will see that 140 character limit that we have been trained in our brains now through social media to accept in our mind. So try to get it shortened if you can. I want to end with this quote, and I know I'm a little bit over, but one can only walk so far from one's true self before the bond either snaps or pulls one back. So in trying to understand who you are, who you want to be for the community, I just don't want anyone to lose sight of their true self and only become a label that the medical community has decided that you will have. You are still a person with your own thoughts and feelings and hope. And now more than ever, we all need some hope.
Thank you, first of all, Amber, so much for your time and for that excellent presentation. So thank you all again so much for your participation. Thank you again, Amber, and we hope that everyone stays well. And please, if there's anything we can do to assist you, don't hesitate to reach out to us at the council. So thanks for joining us today.